Welcome to today's press briefing. We have with us two speakers. They are the head of the Communicable Disease Branch of the Center for Health Protection, Dr. Chang Shuk Kwan, and Chief Manager of the Hospital Authority, Dr. Gladys Kwan. The two doctors will report the situation in relation to CHP as well as HA. Good afternoon. We have 1,645 positive cases reported yesterday, including local direct positive PCR cases, 276 cases, and verified RAT positive cases, 1,369. We have 196 imported cases, including PCR positive cases 183 and verified RAT positive cases 13. Today, we have not received from the Hospital Authority any death cases. So far, for the fifth wave, we have death toll 9,192. I'll defer to the Hospital Authority for the admission situation. Good afternoon. Currently, we have 787 patients being admitted. 123 of them are new patients. Those that are in isolation facilities, there are 298 of them in isolation wards. 19 of them are in a second-tier isolation ward. 235 of them are in the North Lantau, Hong Kong Infection Control Center. There are 101 new cases. Yesterday, we've reported 2 patients in a critical condition and 4 in a serious condition. Of those that are being admitted, there are 13 patients in a critical condition and 15 in a serious condition. Three patients in a critical condition are in ICU. In the past 24 hours, we have not recorded any death cases. I'll now defer to Dr. Chuang. Of the 196 imported cases, there are 145 that are confirmed at the airport, including 83 those arriving on the 3rd and 63 arriving on the 2nd of July. There are 37 cases picked up at the hotel and 14 cases that are confirmed after they have left the hotel. They have all got a high CT value. They may be repositive cases. There are 5 care homes, including 3 care homes for the elderly and 3 care homes for people with disabilities that have recorded positive cases. In each of the care homes, they have 1 case. There are 4 care homes with 1 resident being confirmed and 1 care home with 1 staff member being confirmed. Their close contacts will be sent to quarantine. We have recorded 600 cases from schools, including 485 cases of students and 185 cases of staff members. On the face of it, 600 may be high, but they are spread over several days. Today, there are 130 cases. Yesterday, 133. And those positive on the 2nd of July, 114. And those positive on the 1st of July, 141. 83 cases were tested positive before the 30th of June. On average, we have about 114 to 133 cases per day. Of the 600 cases, they come from 421 schools, including 85 kindergartens and childcare centers, 170 primary schools, 159 secondary schools, and 7 special schools. That includes 485 students, 115 staff members. In the past 7 days, we have 204 schools with at least 2 cases, including students and teaching staff members that have been infected. We are conducting investigations into the epidemiological linkage. We have recommended that the following 4 schools will have to suspend their face-to-face classes. There is 1 Ma Tau Chung Government Primary School, Class 6C. There are 3 students and 1 teacher having been infected. There are 2 students that are known to be BA4 or BA5 subvariants. So we suspect that the students and the teacher might all be a case of surveillance. So for this class, face-to-face classes will have to be suspended. There are other schools in other classes of the same school, and these classes have got one case, including 1A, 6A, and a teacher of 6A. We ask them to monitor the situation. For the another school is Lô德會梁巨苗Primary School in Sha Tin, Class 3C. There are 26 students. 3 of them have been infected. This class will have to be suspended. For Cheung Shui Jockey Club Road Tung Kun Hospital, there is one class 3CD with 20 students. 3 of them have been infected, so they have to suspend classes for 1 week. And in 三水同鄉會禤景榮學校 Class 1D, there are 3 students that have been infected. There are 22 students in that class. So for classes of these 4 schools, they have to suspend their classes for 1 week. In relation to subvariants, we keep hearing about BA.2.12.1 or suspected BA4 or BA5. For BA.2.12.1, there are 34 cases today. 20 of them are local cases with an unknown source and 14 cases linked to other cases. For BA4 or 5, these suspected cases, there are 11 cases today. One is another case of hot pot foodie. So altogether, there are 15 customers and 1 close contact that have been infected. For the Ma Tau Chung Government Primary School Class 6C, with 3 students and a teacher, they are of this variant. There are also 2 cases from one family in Ho Man Tin Estate, Shengman House. There was previously a case in the same building facing a different direction and on a different floor. There is also 1 case living in Yiu Tong Estate, Yiu On House. That case and the family member have been infected. There is also 1 case that may be linked with imported case living in Hoi Ming Court. Someone who works at the airport from the customs and excise department. That person came into contact with people arriving in Hong Kong. Every day that person would do an RAT as well as regular PCR tests, and the most recent PCR test was positive. So that's all for my report today. In the past day, there are 97 patients that have recovered, including 90 patients that have been discharged. In the 5th wave, so far we have 52,216 patients that have recovered, including 51,885 patients that have been discharged. Since beginning of 2020, we have 64,596 patients that have recovered, of which 64,265 patients have been discharged. There are 3 patients that have been confirmed via admission screening. 4 patients in the same cubicle are classified as close contacts. In terms of staff members, we have 24,481 staff members that have been infected, of which 24,152 of them have resumed duty. Now I have two announcements today to make. On the 3rd of July at Caritas Hospital, through admission screening, there was 1 patient that was found to be infected. During that time, she stayed in a medicine ward in Caritas Hospital. We conducted contact tracing and found that in the same cubicle there are 2 other female patients that were positive on the 4th of July. The 3 patients are being treated in isolation facilities. They are in a stable condition. There are 5 other patients that are close contacts. They are under quarantine. For this ward, we have stopped receiving new cases and suspended visitation. We've also conducted thorough disinfection. We'll continue to monitor the health of patients and staff members. We're in close contact with the CHB and will update them as necessary. In relation to a forensic psychiatric male ward in Castle Peak Hospital, there are another 3 patients that have been confirmed to be positive. They are now in isolation treatment. They are in a stable condition, and there are 7 patients in the same ward that are classified as close contacts. They are now being quarantined. In relation to this ward, there are 4 patients and 3 staff members that have been infected. We've taken samples for analysis. We are also conducting a genome sequencing analysis.
We now move on to the Q&A session. Please use the microphone and please identify your media organization before you ask your questions. Good afternoon, doctors from TVB. I'd like to ask about Mao Tao-chung Government Primary School. Are you talking about the one in Hong Kong? And why would there be 2 with BA.4 in the same class? Do you think that they actually got infected through the school or via the family? Now we see new cases of BA.5 in schools. So what do you think of this situation? For reinfection, do you see that reinfection patients would have milder symptoms and that their situation would actually be a bit more steadier than during the first infection? We believe there is actually transmission in the Mao Tao-chung Government Primary School, so it's 3 students plus 1 teacher. Much like other cases, or much like what's happening in other schools, we see only a couple of cases, so we decided to suspend face-to-face teaching for a short period of time, and that might be effective. They actually do RAT tests every day, and actually it can help prevent further transmission within the school. We do not see many reinfection cases, only a couple so far. So actually we do not have an overall view of how the situation is at this moment. It's in Fuk Chang Street, number 1 in To Kwa Wan, the Mao Tao-chung Government Primary School. Next question, please. Good afternoon from Cable. First of all, experts have said that the subvariant of BA.4 and BA.5 would become the main or dominant variant in Hong Kong. So what does CHP think of that? Do you think that would become the dominant variant in Hong Kong? We see reinfection cases. So if you've been reinfected with BA.2, would you actually be reinfected with BA.4? Would you have a protective barrier? And I'd like to ask about the other customers from Hot Pot Foodie. Do you actually have a genome sequencing of those patients? Which variant were they infected with? There should be 1 case, that's BA.5.2 from Hot Pot Foodie. We're still working on the other cases. We believe there would be similar cases. BA.4 and BA.4, we see transmission is very fast overseas. Therefore, it may become the dominant strain. But of course, it differs everywhere. I can't really say that those who have been infected with BA.2 in Hong Kong will be reinfected with BA.4, and I'm not sure whether they would become reinfected. We would continue with our observation, and right now we actually do not have an overall view of how the situation is. Next question, please. Good afternoon from Now TV. I'd like to follow up on the BA.4 and BA.5 cases, 11 in total. Are they all untraceable? Hong Kong has gone through the 5th wave. Do you actually have enough of a protective barrier to prevent BA.4 and BA.5 from becoming a dominant strain? We have around 1,600 cases per day. Would you estimate a surge in the number? And when will we actually reach a peak in this wave? Out of the 11 cases mentioned, there are 3 groups of people who are untraceable. One of which is the Ma Tau Chong Government Primary School students. 3 of them. And we would also study and analyze the genome sequencing of the one teacher as well. We do not know the traces at this moment. The other is Yuan House. We do not know the origin yet, probably got it from the family. And for the one living in Hoi Ning Court, we still do not know the traces yet. So there are 3 groups of people. We have not found the traces yet. We really cannot estimate how the situation will pan out in Hong Kong. Orange News. I have a question regarding the Ma Tau Chong Government Primary School. Do you know whether it was the teacher or the student who became infected first? There are cases in other classes as well. Were they infected by the BA.4 or BA.5? Are those 3 classrooms on the same floor? Are there any contact between the students of these 3 classes? Subvariant actually has a highly transmissible. Do you think there would be another break in Hong Kong? Currently, we believe the teacher became unwell on June 28th, so it might have started with the teacher. For other classes, we really cannot tell whether they are related because we were not sure whether they were infected in the community or whether through their classmates. We do not have any information on that yet. There are some individual cases in other classrooms. So there may be other cases or individual cases in other classrooms. So we are not sure whether they're related and whether there is a need to suspend classes. In case BA.4 and BA.5 become dominant strains, how would that affect Hong Kong? We would need to continue observation. Because people are infected with different strains and different subvariants, and it's actually different in every place. Therefore, we can't really just give a general picture.
Okay.
I'm from Mingpao. I'd like to ask about the Ma Tau Chong Government Primary School. How many cases are there in this school? So is it only BA4 or 5 in relation to that class? Or there are other cases? So how many BA4 or 5 cases are there in Hong Kong that involve schools? How do you assess the risk of transmission amongst schools? In relation to hot pot foodie, you said that there was one case that you expected it to be a reinfection. Do you have an answer yet? For the 100 or so customers that evening, how many people have been tested? How many people are still being contacted? Well, you did not tell us about the accumulated number of cases in the 5th wave. And can you give us the names of the care homes? Sorry, I missed that part. It's 1,241,380 positive cases in the 5th wave. For Ma Tau Chong Government Primary School, accumulatively, from the 30th of June, well, actually the 28th of June to now, there are 8 cases. 4 are related to Class 6C, and the others are scattered cases. We don't know yet whether they are related to Class 6C, so we don't know whether they're related to BA4 or 5. So far as we know, BA4 or 5 cases in schools is this school and a previous secondary school. The suspected reinfection case, we don't have the result yet. Hot pot foodie. Most people have been tested, but there may be a dozen or 20 people that are still waiting for the result. If they knowingly do not do the test, then we will take action. Names of those care homes. Hòa門居護理院舍 1 resident. St. James Settlement 福康服務翠日居 1 resident. 耆康會關泉護理安老院 1 resident. Helping Hands 匯豐銀行護老院 1 staff member. Caritas Jockey Club 樂和宿舍 1 resident. And the gentleman over there. I'm from AM 730. You talk about the government primary school. There are 8 schools, 6A 4 cases, and 6A 3 students, 1 students, and there is also 4 students. What is the other school? What is the other case? What about other classes? You talk about a custom and excise officer suspected BA4 or 5. That person will come into contact with arrivals. Can you give us more details? You talk about BA4 or 5 being the dominant strain. Do you expect that it will take some time for that to happen or within a very short time? We keep seeing imported cases that are picked up after the 7th day. There are many cases that are not positive cases from arrival cases. If the quarantine period is shortened, will that put pressure on the situation? Perhaps I wasn't clear. Class 1A, 1 student and 1 teacher that teaches 1A for the Ma Tau Chung government primary school, and for class 6A 1 student, another one is class 4C. That was a 30th of June case. B4 or B5 suspected cases, they now account for 1% of our daily number of cases, maybe lower than 1%. So it hasn't become the dominant strain yet. We're aware that for BA4 or 5, they have a high transmissibility, but we cannot gauge how fast it would be if they become the dominant strain. For those cases that are picked up after the 7th day, we suspect them mostly to be positive cases. There may be a handful of them that are cases identified on the 8th or the 9th day. They might still be infectious. The incubation period of Omicron is shorter, but there are always individual cases that have a longer incubation period. For the customs and excise officer, the extent of the contact might be handing over documents to the arrivals. If there are no other questions, that's the end. Last question. Hong Kong Economic Times. I'd like to ask about the government primary school. Class 1A, 1 student and 1 teacher. Does that class have to suspend teaching? And class 6C, how many students are there? For home NT and sick man house, you mentioned about BA.2.12.1. So is it really a BA4 or 5 case? And what time was that case? In relation to hot pot foodie, how many tables are involved? And what about the layout? Class 6C, there are 23 students. For class 1A, there is 1 student, and the teacher might be teaching at 1A, but the teacher might teach other classes. We have to see whether there is any transmission. If there are only 2 cases, it's less than 10%. You talk about sick man house. We have to see whether it's BA4 or BA.2.12.1. If it's BA.2.12.1, then it might not be related to this case. The tables. We have identified some tables, but they are not in close proximity. So there is a distance. Last question.
TV News. So first question, quite a number of experts said BA.4 and BA.5 will become more dominant in Hong Kong. And how will the authority prepare for the dominance of the new variant, and should we be worried about it? And the second question, the new Secretary for Health just now wrote a blog saying he expects the border with the mainland could be reopened as soon as the 4th of August, that is the Chinese Valentine's Day. And one condition for the reopening of border with the mainland is to reduce community infections as much as possible. But given that we now have more than 1,800 new infections every day, and the more infectious subvariant is going to be more dominant, how possible it is for the authority to reduce the community infections to acceptable numbers within just 1 month? Thank you.
We understand from the overseas experience that suspected BA4 or 5, BA.5 may be more infectious and more transmissible than other Omicron variants. So I think as long as the proportion of cases, the symptoms are mild, and the proportion of death and severe illness are low, I think of course we would like to control the spread as much as possible, but because of the highly infectious nature of this variant, it may not be possible. That's why we will concentrate on monitoring the severity of this illness, and as long as it is not, we are fully vaccinated, and the proportion of severe and death cases are low, and we may not be as worried as that. Of course, we still have to maintain a high vaccination rate, because a high vaccination rate of 3 doses will likely to reduce the proportion of severity and death among all Omicron cases. As for the other control measures, I'm sure the Secretary of Health will lead a group to discuss further measures.
今日記者會完結，多謝大家。